Goodness. So this is June 2nd, and this is the Shutesbury Board of Health meeting, which we are having by Zoom, and it's being recorded for anybody who wants it. We have here 4 members of the Board of Health, and we also have several people from DEP, and we have a couple of people who I don't know who they are. They are Brian Harrington and Elizabeth Steinhardt. Could we unmute them and find out who they are?
So they should be able to unmute themselves.
Yes.
Okay.
This is Brian Harrington. I'm the Deputy Regional Director at the Department of Environmental Protection in Springfield office. And
Great.
I oversee the Bureau of Water, which is wetlands, wastewater, drinking water, municipal services programs.
Thank you.
And I'm Elizabeth Steinhardt, and I'm with the Western Region of DEP and the Bureau of Waste Site Cleanup.
Wow, you guys are really well represented here tonight.
Great, perfect.
Yeah, we appreciate your time.
We really do. Well, I'm Catherine Hilton, and I'm the clerk of the board. Why don't we all introduce ourselves?
Okay, I am Arlene Reed, and I'm a member of the board.
Hi, I'm Noreen Pease. I'm chair of the board.
Garrett Simonson, a member of the board.
I'm Mary David. I'm a guest.
Oh, hi, Mary. I didn't notice you there. Mary is one of the candidates for the Board of Health, so she's been shadowing us a little bit.
Welcome, Mary.
You guys probably know, or maybe you don't, DEP people, that everybody in town knows about this. That we publicized it as soon as we could on Friday. So we don't want to have any secrets here. So we thought that citizens might show up for this meeting, but apparently not. So what have you got to tell us? Do you have a sort of program that you're going to tell us, or how is this going to work?
We really didn't have a program set up other than to answer your questions that you have. The region is here to be able to represent the folks that are closest to the ground from DEP out in your neck of the woods. And Jody Cutler is here, DEP's contractor for UMass, who's conducting the private well program sampling. And we're here just to answer your questions.
Okay.
Although I would say that we are prepared to pretty much talk about anything PFAS that you have questions about. So if I'd like to hear more basic information about what it is and why we're concerned about it, up through the detailed information about the private well sampling. It really is your call.
What we're really interested in finding out is what's going to happen next. I mean, we've got this horrendous well over by the fire station, and we have been told that there's going to be an investigation, and we'd like to know what's going to happen.
What we expect to happen at this point is to do an initial investigation around that well, the problem well, see if we can get some other private wells to agree to allow sampling. We want to do that. We'll look at some land use activities in that area to see if we can determine what might have contributed to the levels that you see in the sampling results. And based on what comes out of that, we'll determine what the next steps are in our plan.
And when would this start to happen?
That's a good question. We'll start doing the land use analysis almost immediately. We'll start talking to folks in town and do some information gathering that we can start next week or the week after. The sampling will take a little bit longer. Want to make sure we have the contractor on board and can do some of that sampling. We need to get some access, if we are able to get access to some private wells in the area, some residences in the area. That may take a little bit of time to get those agreements in place so that we can access those properties.
Elizabeth, this is Noreen. Can you say a little bit more about what is involved in a land use analysis?
We're going to look at different activities that happened in and around that area. I understand this well is on the fire department property. Is that correct?
Yes.
So we'll speak with a representative from the fire department, someone who's got some history there that might know if there, what activities have been there, if there's any fire training. We have, knowledge that firefighting foam contains PFAS, and maybe there was some deployment of foam in that area at some point that may have contributed to these conditions. We'll look at other land uses around that area to see what might have contributed. We'll try to determine if we can tell which direction groundwater flows and those kinds of things.
Thank you.
Are you, Elizabeth, or any of the others of you familiar with the past investigation of the fire station when there was gasoline contamination?
I am somewhat familiar with that. That's before my time in history department, but I had looked into that. I understand there was an underground storage tank that leaked.
I believe so, yeah.
Yeah, and my understanding is that that site, we call that a site, had been cleaned up to a temporary solution. There was some gas vapors under this slab, I believe.
Yeah.
But for all intents and purposes, it has been cleaned up. The soil's been cleaned up, and the groundwater is below any concentrations.
I was wondering if there was data about the groundwater flow and other things about it, because it's already been investigated once.
There probably is, and we will certainly look at our records in terms of what information we already have, and confirm anything we've heard subsequently.
And one of the things that we might be interested in is whether there are existing groundwater monitoring wells that were installed as part of that past investigation. That would make sampling the groundwater and getting an idea of kind of what the spatial distribution of the PFAS might be. That might make it easier.
I don't think so, but Al would probably know more about that. A couple of the things that we have been hearing from the public, one of them is, how can I get my well tested for PFAS? And another one is, where's my sample kit that you said you were going to send? And another one is, where are my results? I sent my sample in weeks and weeks ago.
So I think there are two answers, or probably three answers to the three questions. For the kind of moving ahead into the future, Elizabeth and her group in the Wayside Cleanup Program, as she mentioned before, will be looking at kind of starting at the well that we know to be contaminated and working outward from there to try to find adjacent wells that are most likely to have similar contamination and working outward. So to the extent, as she mentioned, we'll be looking for access and contacts with the nearby residents in order to sample their wells. So I think that's one of the areas where the board may be helpful to us in putting us in contact with people and working with us to get that access to that. For people that live further out, as you can imagine, we're starting where we know it's contaminated and working out. The questions of the people who had already signed up for the private well sampling program and the implementation of that, I'll look to Jody Lynn Cutler, who's working with us in UMass on that program. Jody?
Hi. So we are moving ahead. We have 72 people in town who have applied to be part of our program. There is a cap of 40 people, 40 wells that will be included in the program. We had a rate of only a third of people that signed their agreement form, that we approved, signed agreement forms and proceeded with sampling. Shutesbury has a much better return rate. So of the 63 that we approved, 39 have already signed their agreement forms. So we are basically at our limit. And all of those have had sampling kits sent out or will be sent out next week.
Okay.
Yeah.
So the investigation that is taking place around the known contaminated well, that is separate and above and beyond the 40 cap limit on the private well sampling program that is being conducted.
I'm
So
sorry, can you repeat that, please?
Jody mentioned that there's a cap of about
Yep.
40 samples for that private well sampling program, which is a
Mhm.
program we're implementing across the state.
Right.
That is different from the investigation that Elizabeth and her staff will be conducting around
Okay.
the known contamination.
Got it.
Any sampling
Okay.
that's done around that well and working outward does not count towards that cap. We can do as many samples as we need to find what contamination is there in that
Okay.
area and where it's coming from.
Right. And there are people who have applied that are nearby both the fire station and the old orchard area of contamination as well. And they're already in the pipeline.
And is a similar investigation happening at that second well, or is it only at the fire station?
Point, we haven't made that determination yet. We need to have some internal discussions. Our resources are unfortunately not infinite. And our concern is the levels at the well at the fire station as they're
Sure.
approaching, an imminent hazard.
Sure.
That's not to say that, we aren't concerned about other levels as well, but
Sure.
that one is certainly on
Okay.
our radar. We
Okay.
really want to address that.
Sure. So the other question we've been hearing is how people can get, if people want to go ahead and test their own wells who are perhaps outside the zone that you're going to be working out away from the fire station. I've seen the list of labs that are certified, and there certainly aren't very many. Is this going to be a problem? And is this going to be a complicated thing? What we hear is that it's very complicated and not easy to actually take a sample.
I'll try answering and then somebody else may join in. The good news is that anybody who is going to take their own sample can benefit from the educational material that we have online that talks about how to take samples, what you have to consider. All of that is available at, if you Google or use some other search engine to find Mass DEP PFAS, you can get to our PFAS page and find all of that information. So that's applicable whether you're taking samples as part of our program or you're doing it privately.
Okay.
And what I'll do after this meeting is send you links with references to those documents so you'll be able to find them readily. For example, there's one part on our website that guides people about answering the question, how can I test my own well for PFAS? There is a process one needs to go through, but it's a routine process because there are a lot of tests occurring for the private well program and for all the public water supplies across the Commonwealth. There is some lag period to get the results from the labs, as one would expect, but that's something that can be done readily and routinely by a homeowner.
And how expensive is that?
Heard $300 for PFAS.
Okay, good to know.
I think one of the things people should be doing though is also looking at other situations they have with their water. For example, if they have an existing sediment problem, they may want to look at a holistic approach to their treating their well water. If they have problems with hardness in water, if they have problems with sediment, if they have problems with PFAS, to work, find what kind of tests are available needed for those things, and then work with private companies who can provide treatment solutions for that.
Okay. Thank you.
If I could just address your question before about it being complicated to sample, it's no different other than arranging for your own sampling kit to arrive at your house. And Arlene, you sampled your house. Did you think it was complicated?
There, you had to be attentive to detail, but no, it was, once you read through it all and, yeah, it was very straightforward.
We've had good results when people get hits, having taken the samples and going back and doing confirmatory samples. We find that the results are fairly consistent, and the homeowners that have been doing it have been doing a good job.
Good.
Very good.
Found it was a little complicated. And I think part of it was that the pickup for my sample guy, he just arrived unannounced some Saturday morning early. And I don't know if I'd missed the pickup or what, but we had to scramble to make it happen. So I found that a little bit of, just say like, okay, now what am I supposed to be? Okay, now is this a simple then? And so there's that. The other question I had, and I'm sorry if this got answered, and if it did, ignore it. I was having trouble with my computer. It chose to update right at the start of the meeting. Was sort of this issue of how long it takes to get a sample analyzed, and if these known contamination sites are going to be fast-tracked in any way. And then what is the advice that you have for people during this time? Is it just basically use bottled water for drinking?
I'll take a shot first. To answer your second question first, using bottled water is the quick, effective way of eliminating the exposure and making sure that you're certainly drinking uncontaminated water. I would also point out that, and Fred probably will include this in the links, that there is information available about your testing PFAS in bottled water, so that in making this recommendation, we feel fairly confident, both in the work we've done in the Department of Public Health in their regulation of the sale of bottled water in Massachusetts, that in making this recommendation, it is a safe and appropriate alternative. As far as the turnaround goes, lab capacity has been increasing, but as you mentioned, there are a lot of samples being taken in site investigations and for public water supplies across the state and in other states that are all trying to use the same resources. So I think the turnaround time is probably about 3 weeks now, 4 weeks, Jody?
Well, it's at least 3 weeks to get the analysis, but because we're being very careful with our quality control, there is a quality control process, and there's quite a bit of backlog with that, I must say. So, but what we do when we have the raw results, before it's gone through our very extensive process of double checking everything, we call homeowners if it's ever over half the maximum contaminant limit. So if it's 10 ppt or greater, we ask them to do a confirmatory sample. And then if it's over 20, I will call it the individual homeowners and let them know. And there's never a delay. That's within a day, within 24 hours, you're called to immediately know that information. So that's not withheld from you, whatever.
So there will be different timelines if you're doing the sampling through our private well testing program. There's the analysis and then the QA/QC. If the well is being sampled through the waste site cleanup program site investigation, that will have a different time frame. And if you're a private homeowner who just wants to sample their own well and send it into a lab, that may have a different time frame. All in the 3 to 6, 8 week range, probably.
Also, the issue of what people should do in the meantime. One of our FAQs has what options should be considered when PFAS in drinking water is above drinking water standard. It talks about sensitive subgroups. It talks about how it's ingestion of water that is a problem, that washing water is not a problem. For washing items that go directly into your mouth, you should take care of those. In most situations, water can be safely used for rinsing food. So that information that gives the homeowner the guidance about what they can do is in our FAQs, and I'll make sure to send that to you with a reference to what question it addresses
Right.
that.
We have that actually, Fred, and we've put it on our website for the public to use.
Excellent.
And also, you know, the bottled water list and quite a few other links.
Yeah, if
So-
if there are bottled water brands that are not clearly on that list, but are sold in Massachusetts, are they considered safe?
I guess I'd answer that question a little bit differently. Is that the Board of Health, the Department of Health has a list of bottled waters that have been tested and have been found to be safe. So if someone's concerned about the quality of water, they should purchase the brands of water that are listed and have already been tested through the Department of Health.
Okay.
It's a voluntary program.
Thank
And
you.
on the subject of public education and information, if the board were interested in hosting an information session, you know, Zoom style information session for the public, could we access DEP staff to support that session?
I would think so. That's something we'd have to work out with the region. Brian, you may want to weigh in on this, but the information that we have about the program, particularly the information that's in our FAQs, is all public. And at least when I've been giving presentations about PFAS, I've been relying upon those FAQs as paraphrasing what's in the FAQs to provide that information for people.
And actually, I had sent Fred, I was going to be forwarding links, and I sent him all of the links that are on the typical public notice that we would use for a public water system, so that we're sharing that information with all of the private individuals that would otherwise get it from their water supplier if they were drinking public water. So I've sent those over to Fred to provide, including a link to the DPH water that's been tested. So it was probably stuff Fred was going to send anyways, but I've moved that along. In terms of additional meetings, you know, if you're doing something, I would request it. You can either do it through myself or through our regional director, Michael Gorski. And we will see some things you know, particularly when we're working with private individuals, we are sometimes limited in terms of what we're able to discuss to respect their privacy. We also are dealing sometimes with unconfirmed results that we don't want to necessarily discuss until we've got confirmation the quality assurance, quality control has been done as well. But, you know, I think certainly we'd be, you know, keeping the Board of Health up to date in terms of our investigation and things like that as we move forward, so that you're aware as we proceed as well.
The way that we've done these sort of community question and answer sessions has been, I think, quite good. We have a moderator who is the go-between and runs the meeting. And so it's a process of collecting questions from the community in advance and then sort of sharing those with the people who will be answering those questions. So we try not to have too many questions that are sort of out of left field. And we handle those first, and then we open it up if there's time for additional questions from the community. I have another question, if I may. There's some confusion and just lack of information about sort of the next steps about how much a treatment facility, not a facility, but a treatment method costs for the homeowner, and how effective that is, how easy and straightforward it is. There's some talk about charcoal filters, whole house charcoal filters that seem to work well if you are on a schedule of replacing the filter. So could you address that a little bit?
Sure, I'll take a stab, and if anybody else wants to jump in. In our experience, and we've done this at a number of locations, homes across the state where we've been doing investigations and have needed to do it, that granulated activated carbon is effective in treating PFAS compounds. And the cost of installing kind of one of the systems that we put in, and these are state costs, which also include a lot of testing and costs that perhaps might not accrue to the normal homeowner, is probably in the $5,000 to $8,000 range. But again, I would check with, these are dual systems with UV treatment of the water coming out. There are a lot of requirements that we go through to do that. So, but they are relatively off the shelf carbon treatment systems, point of entry treatment systems that treat the entire house. You can also get carbon systems that are smaller that are point of use treatment, but there are some systems that are certified by the NSF. What does NSF stand for?
National Sanitation Foundation.
Sanitation, thank you. I always want to say national science and I get stuck. The problem with their certification, it's not a problem, but is that the Massachusetts standard is 20 parts per trillion, as you know. The NSF certifies, because it's a national foundation, they have been certifying systems down to EPA's guidance value of 70 parts per trillion. So it's, they may in fact be effective down to 20 parts per trillion, but there isn't the testing and data to show that in this new certification. But our experience with the point of entry treatment systems, the carbon canisters, is that they have been very effective, and we have installed them. The earliest ones we installed probably 3 years ago now, and we do routine monitoring the incoming raw water. We test between the canisters and we test the outflow. And I think to date, we haven't even seen breakthrough in the canisters. That they're very effective in treatment, and they last for quite a while.
EPA has a contaminant database, and looking at PFAS on the database, they say that they found a granular activated carbon to be highly effective for the removal of PFAS. One of the things that we suggest that people do, since the national standard is keyed to the EPA's guidance of 70 parts per trillion, if you choose to install a treatment device, check with the manufacturers to see if they have any independently verifiable monitoring results demonstrating that their particular devices can reduce PFAS below 20 parts per trillion.
Yeah, right. Because I think there would need to be some confidence for a homeowner, because the alternative is that you end up sort of having tests done every month just to make sure that the thing's working, And
at $300 a test, you don't want to do that.
Exactly.
Right.
Yeah.
Mm-hmm.
I don't know whether they have some volumes that they can identify based on your PFAS level. I'm not sure. I know I deal with larger systems, community systems, and it's the same technology. It's granular activated carbon the water going through it, and PFAS has a real affinity for that carbon, and it just grabs onto it and it stays in that canister. And on the large systems, you monitor much like the small systems Paul talked about between canisters to watch for breakthrough. And you tend to sort of get a sense of how much of your water and it's able to treat before you need to start watching it closer. So I think it's, there's a little bit of a learning curve there on this stuff.
One thing we have noticed, and it makes sense, the systems that we installed are lasting quite a long time now. And that's partly because the levels of PFAS that we're concerned about are very low. compared to other contaminants. These carbon systems are often used to treat, say, chlorinated volatile compounds like trichloroethylene or tetrachloroethylene or benzene at levels that are 1,000 times higher. So a lot of these systems are geared towards more contaminants in the water. So it's not surprising that the systems that we have installed have in fact lasted for quite a while, because the amounts that we're talking about, the concentrations, are of concern, but they are relatively low, which hopefully means the carbon lasts longer.
Paul, I think I must have missed what you said about the context in which you were installing these systems. I mean, were these in residential? I mean, what was this about?
So in the bigger picture of things, PFAS compounds are, we commonly refer to them as emerging contaminants, which should kind of let everybody know that we're learning as we go along. We really started paying attention started grabbing headlines about 4 or 5 years ago, and we started seeing major sites about 3 years ago, as we began looking at lower and lower levels. As we're this learning process that we're going through, trying to figure out what's of concern, what treatment technologies are available, and where the material is coming from. We're still in this learning process, which is why we're doing this private well testing program. That's to find out statewide where it is, at what levels, and where it's coming from. So it's part of the learning process. So part of, in the early days, as we're finding it, we need to figure out what would work, what technologies would work, and where we found what we would call imminent hazards, we would work with the homeowners, and in case where the homeowners could not address the imminent hazard, then we would install these systems to make sure that the water that was being used was potable.
I see.
So,
thank you.
Okay.
No. So I've been wondering about the testing program. I know that there was a fairly short fuse on this. It had to be spent by the end of the fiscal year. Is there any prospect of its being reauthorized to do again in the next fiscal year?
There are amendments to the budget for the next fiscal year that would authorize carrying over the money that was previously given to us to spend in the next fiscal year. I think so that would be good news overall for the state. I think for Shutesbury in particular, I think as Jody had discussed before, we've pretty much hit the limit for that pot of money for how many samples can be done under that program. Again, that has no effect on the site investigation that we're doing, but Jody will be moving on to other towns.
And the reason for that is that that particular program was tasked with trying to get a sense of the extent of PFAS contamination in areas of the state that are served by private wells. There are 84 towns that we're looking at. So that's a research component, if you will. The Bureau Waste Site Cleanup component is finding the extent of known contamination, which is sort of different purposes, but they're complementary to each other.
And a different pot of money.
That's true.
One that does not go away.
Oh, good point.
Can we expect that that there will be state money that will be available to help people sort of remediate these problems? And indeed, will DEP pursue these investigations into now known contamination sites, or is that in some way going to fall as the responsibility of the town to do this?
My answer is going to be a little bit complicated. And so the DEP, as we're finding sites with elevated levels of PFAS through this program, we are kind of going through a triage process, and certainly the higher levels, we are fairly quickly initiating investigation to find out what's going on around those properties. And part of our goal in this is the safety and health of the people in the surrounding area, to make sure they're drinking potable water. But it is also the goal to try to find out where it's coming from. And in the wayside cleanup program, that means identifying a responsible party that would take on the investigation and the cleanup of these sites. So relieving the burden of the homeowners. And then the question is, who are these responsible parties and kind of what resources do they have? And some of the responsible parties that we have found for some sites, particularly where it's contaminated public water supplies, are entities like the Department of Defense, the US Army, the Air Force, some airports. We have some industries that have used PFAS compounds as part of their production process, and they have been identified as being responsible parties, and they have taken up the investigation. And then, of course, there are towns that are the responsible parties, either through the fire department or, and you have this experience with the leaking underground tanks at the fire department here and at DPW, where if the towns can also be responsible parties as well. So we have yet to clearly identify a responsible party here that will be part of the investigation. And then, we will work with the responsible party if we find one. We're able to conclude and then the investigation at that point and the potential obligations for either cleanup or addressing the exposures that are occurring will be worked out then.
I see.
Speaking more broadly about PFAS across the Commonwealth, one of the results of the study that we are doing with our UMass contractor will be looking at what the implications are of what we find for PFAS across the Commonwealth. There's also legislature has started an interagency PFAS task force that is looking at questions like what are the best approaches to be used for individuals if they find PFAS in their drinking water? What are the long-term effects? What can Massachusetts do to be able to reduce the input of PFAS into the environment? So as Paul said earlier, with this being an emerging contaminant, there are a variety of different drivers of trying to figure out what the next steps are. I came back from retirement to work on PFAS program. What I was surprised about was the DEP was working on private wells. DEP does not directly regulate private wells, yet there was money made available. So DEP is going ahead and providing service to individual well owners to try to characterize PFAS across the Commonwealth. It was a little surprising to me. I think it's a good thing to have happen. Some of the outcomes of that will be studies that indicate what the next steps are.
And I think it would be very useful to be in touch with your legislators and encourage them to participate, sit in on this PFAS task force. They had their first meeting on Tuesday. So it just kicked off the work and it's a legislative task force. And I'm sure one of the issues that will be addressed will be potential future funding for various aspects related to PFAS. The state has already made funds available through a couple of different mechanisms to public water supplies to help them deal with the contamination that has been found in the planning for and installing treatment systems. I think there's a lot more work that the water suppliers would say need to be done there. A lot more money be made available. But also as we find out other sources and look to those responsible parties, I certainly would could see a scenario where the state may, and under some circumstances, provide some assistance there as well. But that would be working through the legislators.
And I'll provide in the links, I'll send you the archive of the hearing. I also noted their 10 goals and what their schedule is extending into the fall. So you'll have that information.
Excellent, thank you.
And it is headed by a couple legislators who have experience in PFAS due to contamination, much like this, that has been found in their communities.
Mhm.
So they are very knowledgeable and sensitive to concerns that Shutesbury may have as well.
One of the concerns that I have is that our shared aquifer is a fractured bedrock system, and which these systems are, as you know, inherently complicated with regard to groundwater flow. And so, when I think about studying a contamination site, it's going to require lots of wells, lots of sampling, and lots of geochemical analysis. And all of a sudden dollar signs start floating in front of me. So anyways, that's just sort of a general comment. And then, not even knowing the source. I mean, the fire station is kind of easy in a way, but the other site we have in town is possibly associated with an old dump, or possibly associated, I understand, with an orchard that used to exist in that area. So my question that I'm finally getting to is, I've heard that PFAS has been used in herbicides or insecticides and applied to orchards. Can you speak to that as a possible source?
Yes. DEP has been doing a lot of work on the pesticide question. It came to our attention last year when Pierre, I forget what Pierre stands for now. I'm getting too old for this. But an outside group, environmental professionals for environmental responsibility, something like that. But they did samples of Anvil 10+10, which was being used last year to spray for mosquitoes because of EEE and all of that. And what Pierre found in the one sample that they took, the initial sample was elevated levels of PFAS in the bulk material. DEP took that up and worked with the manufacturer and worked with the Department of Agricultural Resources, which has a pesticide board, which regulates the application of pesticides. And we did extensive sampling of various batches of these materials. We sent our results to EPA. They did additional work as well. And what we found was that these materials, what we were seeing was leaching out of the containers that the pesticides were being stored in. They weren't ingredients of the pesticides themselves. We've been doing sampling of the batches that are now being proposed for use as we're gearing up for the mosquito season. And we're finding that when stored in steel containers, drums, we're not seeing levels of PFAS at all. So that particular issue, I think, was more of the storage container rather than being an active ingredient. That says nothing realistically about past formulations of pesticides. Can't speak to that. And that's, again, one of the reasons why we're doing this private well sampling because there's a lot of unknowns out there. And this is one way of getting the information, seeing where the levels are elevated and looking and seeing what's around and doing these kinds of investigations. So that's one of the reasons why DEP is stepping in and doing these certainly the initial investigations, partly because we're interested in finding responsible parties, but also partly we want to figure out what's going on. So that's going to inform the legislature and their committee and inform DEP about what needs to be done in the future.
And if the land has been bought and sold multiple times in the past 3 or 4 decades, and what used to be an orchard or what used to be an old dump on somebody's property, wow, how do you establish liability with something like that?
I'm going to start by saying what my lawyers always make me say whenever somebody mentions the word liability, which is, I'm not a lawyer. And because I'm not a lawyer, you should take whatever I say next with a huge grain of salt and consult your own lawyers for the real answer. But the question of potential liability is not unique to PFAS. And it's something that we struggle with not only who is legally liable, but who is available and willing and able to do the work that needs to be done. And I think probably similar to the boards of health, DEP's first concern is the health and well-being of the citizens of the Commonwealth. And we want to make sure that people are drinking water that's safe for them. And then, certainly if there are responsible parties that are willing and able to do the work, and the legal liabilities are complex, and we work with that to find out really who is the people or the entity that can do the work. And in some cases there are none, and DEP has to use its resources and apportion them appropriately, because we don't have infinite resources as well, but to try to get the work done as much as we can. But where there are really elevated levels, and there are levels that require immediate action, DEP is ready and able to make sure that that action gets done, whether it's a private entity or other public entity or DEP doing the work. We don't let money stand in the way. We may come back and cost recover at some point, but we make sure that the initial actions are directed towards protecting the public health.
Right.
Can one of you please remind me about when PFAS first became widely used, like the timeline on this, when they came on the scene, or do we know that?
Jody, do you have that part of your presentation memorized now?
They were first created in the 1940s, but more widespread use started in the 50s and 60s.
They are in lots of different unexpected things. I think Vermont just passed a rule to try to reduce or eliminate PFAS in ski waxes.
Oh yes, right.
They're also found in those popcorn bags that have a nice coating on the inside. So we, as a worldwide society, consumer society, have done a fairly good job of inserting these PFAS pretty broadly into the environment. And the work that Jody's doing with those 84 towns, the areas of interest for each of those towns, is trying to see if there are patterns where PFAS occurs.
The good news is that production of the longer chain PFAS compounds, which we think are the ones that are more problematic from a health risk point of view, were banned. The production was banned, a voluntary ban in the mid-2000s, 2006 or so. And there has been a decrease in PFAS levels in the blood across the country since that ban went into effect. So we are moving generally in the right direction. Having said that uplifting piece, that ban does not extend to other countries. And a lot of the materials that you may be seeing that may be in products now may be imported from other countries. And it really, it's difficult to kind of entirely get rid of them. And we're becoming more, certainly looking more and more at the shorter chain materials and alternatives, that still may have similar chemistry. You may have heard that there are thousands of different PFAS compounds in this broader family. And right now we're regulating 6.
Thank you.
Does DEP suggest that it's wise if someone has been drinking elevated PFAS groundwater to get tested, get their blood tested to assess the possible exposure in their bodies?
Our recommendations, and this is coming from our toxicologists, not mine, not me directly, is that DEP would not necessarily recommend having individual blood testing done, mostly because there's not information available to your physician or to other doctors that would be able to tie a particular blood level with a particular health outcome. So you could find out how much you might have in your blood. You may be able to compare that to national averages, but it wouldn't answer the question that most people would have, which is, what does this mean to my health?
Mm.
The-
Mhm.
There's still a lot of work going on to study and better understand what the health risks are. The standards that DEP set had some um, calculations in them that are fairly conservative. The degree of less risk depends on the level of chemicals, duration of exposure. It assumed that individuals drink only contaminated water. So what we focus on is what people should do if they have the knowledge that they have some elevated levels of PFAS in their drinking water, particularly for sensitive subgroups, pregnant or nursing women, infants, people diagnosed with having a compromised immune system. For older children and adults, the MCL, the level set, is applicable to a lifetime of consuming the water. So shorter duration exposures provide less risk. So the best thing to do is to just reduce one's exposure.
I apologize. I have to leave this meeting. We have some out of town guests and I'm holding up dinner. So I apologize, but I will listen to the remainder of this meeting in recorded fashion. But I really appreciate all of the information that you've provided to us. Thanks so much.
Thanks for your patience with us.
Okay. Yeah.
Thanks for coming, Arlene.
Yep. You bet.
Bye-bye.
Bye.
So I wanted to just follow up on a question that was asked earlier about the relationship possibly between PFAS and the orchards. And while the question of knowing that PFAS has been found in the mosquito side of Anvil doesn't really address whether there's a definite link between pesticides and herbicides used at an orchard. And I want to say that we don't currently have information regarding that. It's not something that we can look for when we're looking at areas of interest, identifying agricultural areas for that reason, though we do include certain agricultural areas that have received biosolids. And that is a known source of PFAS in some instances. So that's the one reason why an orchard may have a PFAS link, but it's not like we identify agricultural lands ahead of time as potential areas. Only once we've found PFAS in an area do we think it may be from biosolids, if there's biosolid records in that area.
Right.
Okay.
Good. Thanks for that.
You're welcome.
And I might add to that, that in terms of our investigation, we'll not only be sampling private wells, but we would do some soil samples, again, closer to the contaminated well and work out in rings. So there'll be that as well.
And what kind of timeline are we looking at this? I'm thinking for the orchards in particular. Is that something that will be starting in the next few months or the next year?
I don't have a clear concept of where the orchards are located in proximity to the levels of contamination. So I honestly, I'd have to find out. I don't know.
Sure.
So
Sure.
it really depends on where, as Elizabeth starts at the known location and works out, we'll be following it where it goes, where it leads us. And if it leads us towards the orchard, that may come faster. But if it leads us in the opposite direction, we may never get to the orchard.
The orchard is the location of the 48 part per trillion in the private well that actually Arlene owns. And she just left.
Yeah.
Yep.
And she has mentioned that, I don't know if it's the dump that caused you to put that area on your map, but there seems to be a dump there around Lady Slipper Lane, still existing today.
Not being used, but you can see
still there.
Yeah, you can see debris, including I haven't seen it, but anecdotally I've heard 55-gallon drums, and so I think we need to figure out what's in those drums.
The region did identify an area near Arlene's for a dumping area, and that's why we sent postcards in that area. Yeah.
Well, you mentioned earlier, the possible problems of getting access to people's wells for testing. I don't think you're going to have a problem with that. I think people really want to get their wells tested.
Well, that's encouraging.
Yes, Jody was mentioning earlier, we're almost completely subscribed, if you will, in Shutesbury.
Right.
And I think that the information I'll be forwarding to you about how people can see about getting their own wells tested using their own resources is something that people will want to take advantage of.
I believe so.
Yeah. But the ease of access or willingness to have the well tested will help Elizabeth and her staff in our investigations as well.
Mm-hmm.
That will be good.
Yeah, I don't think most people will turn you down. Well, do we have more questions to ask these nice people, or are we going to let them go after we've just kept them for an hour?
Well, I guess I have one follow-up question. And it has to do with what do people do once they know that they have PFAS in their water and at levels that are concerning. And because I do think this is going to take some time before we really get to the bottom of it and establish liability. And I think a lot of people are probably going to try to make a move to actually start treating the water in their house. And in the meantime, I've told members of that community that they can come to my house and fill up their water containers. But I'm not sure that my well can support the whole fire station area and perhaps other areas in town. So I'm just trying to think through the logistics of, the next few months.
Al, I can speak to that a little bit. I asked Becky today about providing bottled water for people who are financially challenged and in the area of concern, even if they don't know if they have PFAS in the water or not. And she said she thinks that the town can do that we can buy cases of water for people to pick up.
Okay. Again, it could go on for 6 months.
A long time, yeah.
Year, 2 years.
Oh my God.
Yeah.
Right, but presumably we'll get answers about the worst area soon. Right, I mean, that's where we're really concerned, is around the fire station.
Right, and that's where we'll start with our investigation and try to
Right.
down there.
Right. Yeah. I don't know if you've looked at Shutesbury on the map. Shutesbury was formerly called Road Town. And so the idea of a circle almost doesn't apply. It's just kind of these long strings. And so it'll basically be going, in a line.
Yeah, when I was talking to my son who used to, like I said, used to live at 117 Leverett Road.
Oh yeah.
That usually we work in a couple of dimensions as we spread out from these sites, and people would doubt that. No, you just go in a straight line down the road.
Right. Well, since you mentioned 117, I was in contact with the landlord there today, and he is very worried that his tenants are being exposed. I don't know if you feel that's likely or not. I mean, he does have a tenant in the vulnerable subgroup that we're concerned about.
Yeah, as with any, if people are concerned, then certainly drinking bottled water would be very effective in reducing their exposure and reducing their levels of concern. And I think the testing as we work down the road, we'll see. We'll be doing that as quickly as we can get the contractors on, get out there and get the access.
And you would envision going that far? I mean, you know how far it is, right?
We go where it leads us. So,
Okay,
I mean,
right. So it could be very far, it could not, yeah.
optimistically, I would like to say that, oh, we would just take a couple samples and that would be the end of it. But what we have seen in other locations is because PFAS does not break down and it travels fairly well with water, that we can see extended plumes. So it depends upon which direction the water is flowing. Somebody had mentioned a lot of the water, the wells may be in fractured bedrock, which complicates it, where you could have some wells coming up clean, but another one a little bit further away in a fracture does not. So
Yep.
we'll see. We can only do the investigation and follow where it leads us.
But you wouldn't, so it might skip a house, but you wouldn't just stop if you got to a house that didn't have any. You'd keep testing a little bit more beyond that.
That's part of what we have to evaluate when we get in there, and we'll have our contractors will have the hydrogeologists and the engineers that are expert in this, and we'll rely upon their expertise.
One of the things I remember before we go to Jody from working with the publicly funded assessment and remediation of hazardous waste sites back last century is how difficult that is. It's as I've heard Paul say many times, it really is a case by case situation. There is no cookie cutter way of being able to determine extent of contamination. So it's this wonderful combination of science from different disciplines being used to be able to solve a particularly difficult problem. Jody, you were going to say?
Yeah, I wanted to point out, I believe 117 is west of the fire department, correct?
Yes.
Correct.
So, how close is it to the elementary school? Pretty close.
It is.
It's like halfway between.
Okay.
It's right, yeah, it's right at the junction with Pelham Hill Road. So the elementary school is another maybe quarter mile down.
Right. Okay. So, but I just want to make sure you're aware that the elementary school, as a public water supply, did test and they came back non-detect. So
wonderful.
That's good news.
Yes, indeed.
I guess one comment, you were talking about possibly providing bottled water. I know another community that had tried that, and I think they found it actually more effective to do a voucher or a reimbursement rather than be handling cases of water for those that elected to do it. So
that's interesting.
They just found it to be much less cumbersome than having cases of water delivered and people trying to arrange to pick them up. So something just a piece for thought for you as you do it. The other thing I know, as Elizabeth gets going, she's going to be looking for information and contacts. And if you have individuals in town, I think that would be good for her to speak to, in the fire department, in the Board of Health, people like that. I would suggest that you send that in to us. It'll speed up what we do because we won't be chasing dead ends, just calling everybody on a board or something like that. So if you have some people you think would be good historians, perhaps, and good sources of information, I would suggest just provide that for us.
Yeah, the fire chief has been there forever and he's going to be your main guy, I think.
Okay. There's always that one person in town who knows everything.
Well, he will certainly know everything about the fire station.
I've done
and go ahead, Al.
Yeah, I teach geology at Mount Holyoke College, and so I've done studies on the groundwater situation in town. So I'd be more than happy to talk to people. Yeah.
Oh, Al, before you joined, the question came up: were there any groundwater monitoring wells around the fire station?
There's only the one that is to the south on of the library site. It's not close, but it would certainly be a well that might be worthwhile testing. Yeah.
And what well serves the fire department itself?
There are two wells on the fire department property, and one of them serves the fire department, and I think also the first house to the west. And then there's this other well that serves the known contaminated property, and I think the highway department. We can get the town administrator to sort that out for you, because I know that she knows that well.
Great. I wasn't sure if there was a third well. I knew about those two. I just wasn't aware if there was a third one for the fire department.
I don't think that there is a third one. There is a house currently vacant on the east side of the fire station, and there is some ancient undocumented record of that house also being hooked up to the fire station because somebody thought they smelled gasoline at their well or something. And at this point, that well can't even be found. So we don't know what's going on there, but they might also be connected to one of those wells in some way.
Yeah. We know that some of the salt from the DPW site migrated to the north and northwest, and actually has penetrated the bedrock aquifer down to a depth of 600 feet. So the town drilled a well to try to mitigate and find a new water supply. Can I mention names, Kat?
You're talking about the people for whom they drilled the well?
Yes.
Okay, well, they're the same people who have the well that's contaminated now, so we don't really need to mention their name.
Okay.
The unfortunate well people.
Yeah. So one of the approaches was to drill deeper and drill a little bit further away from that site. So a very deep well was drilled, and unfortunately, it was tested at a couple different levels as being salty. So we know the water is moving in that direction. It probably is moving down Leverett Road as the main contamination plume, and it may even be moving to the south as well, depending on what bedrock is doing. The road is sort of on a topographic high, and it drops off to the north and somewhat to the south as well.
Obviously, we are eager to work with you to complete this investigation. So, call on us whenever.
Yeah.
Great, I appreciate it, and we definitely will do that. It sounds like you have a lot of information that we'll need to access.
Yeah.
Okay, well, if you don't have any other questions, we can let you continue on with your normal business.
Right, yeah, we have a pretty big agenda still to go.
And we appreciate you taking us first.
Oh, well, thank you very much. So many of you for coming. I'm really, really impressed and really grateful. And now we know who you are, and if we have more questions, we'll find you.
I would like to say that we all would have driven out to Shutesbury in person.
Fortunately,
I'm not sure that's true, but I'd like to say that.
I would have, and then listen to the Red Sox on the way home.
There you go.
That would have been a good thing.
And
Thank you.
we'd like to believe that that's all true.
Yeah.
This, joking aside, this is serious business, and really appreciate your attention to this. And with the combination of DEP, UMass, we're trying to bring resources to bear to help. So you'll be hearing from us. I'll be able to get those links to you soon.
That's
That would
great.
be great.
We
Thank
really
you so
appreciate
much.
it.
Thank you.
Thank you.
Good night.
Folks.
Good night.
Good night.
Right.
So, has Mark Olszewski joined us?
He did. He's in the room.
Okay.
Yes, I'm here.
So, oh, there you are.
There I am.
So what's on your mind, Mark?
Well, I just want to touch base and to see if there's any questions regarding the food permit that we submitted. Talking to Claudia on the phone a couple weeks ago, she basically said to, I said, a lot of this stuff doesn't pertain to us, or we don't know what to do with a lot of these questions. She said, just fill it out the best you can, send it in. She says, I'll work beyond it. We might go back and forth a few times. She says, I understand that. And I just basically just wanted to touch base to see if there's anything you need from me at this point, because that, we did want to start our Friday meals. I think we tentatively, like the first or second week in July, we wanted to start doing our meals again.
Uh-huh. Well, what's the status of the food service permit? Does Claudia have to inspect before she issues that permit?
Well, based off of the emails that I saw going back and forth, I guess so. I did not know that, but if she needs to inspect, then we can arrange that.
Okay, yeah, I'm not sure. We just don't have that many,
Yeah, I know Walter comes in to inspect safety, fire extinguishers, fire suppressors for the stove. Walter comes in and inspect, but I don't remember anything from the Board of Health in past years coming into it inspect.
There have been, I know that there have been some inspections.
Okay. So yeah, that's about all I know. If we need to have it inspected, I can set that up.
Okay, well, you just work with Claudia on that. Obviously, if you're 5 or 6 weeks out from starting that, it's not a rush.
Well, that's the reason I sent the food permit to the Board of Health, because I called Claudia a couple times asking for her email address and I never got a response back. So I didn't want to wait anymore. So that's why I sent it to the Board of Health.
Okay, well, I sent it on to Claudia, but I don't know what's happening with it.
Okay.
And you were probably copied on that, so you probably do have her
you're
email
right.
now.
Now I probably do. Okay, so
Yeah.
I will go ahead reach out to her.
Okay.
The other thing, honestly, I think that was about it. And just wanted to let you know that we're opening on the 4th. The bar is opening. And that was really about it.
Okay, and are there any special considerations in place, or is it going to be just like always?
But just like business as usual.
Okay.
We don't, we don't have the one-way traffic anymore.
And you're allowed to serve people at the bar?
We're allowed to serve people at the bar. There's no mask required. It is up to our discretion, but we're not going to have masks. All of our bands for the summertime right now are on the pavilion, so a lot of the crowd will be outside. So there'll be more separation. Yeah, that's really all. I just wanted to touch base, let you know what's going on.
Okay.
So, okay, so I'll reach out to Claudia again and I'll move forward with that. So, do you need me to keep in touch on a regular basis for moving forward, or will you get your information through Claudia, you think? Or I don't want to waste your time. That's just why I'm asking.
If she issues a permit or if she inspects, we'll get a record of that.
Okay.
So, if you have a question or there's something new that you want us to know about, let us know. Otherwise, you can just go on about your business.
Okay. All right. Well, thank you very much.
Thanks for coming in.
All right. Thank you.
Thank you, Mark.
Bye. So, and now on with the show. Can we quickly approve the minutes from our meetings of May 20th and May 28th? It's really crucial to have the minutes out on both of these, because on May 20th, we were not able to record the meeting, or I guess 9 minutes of it got recorded and the rest got lost. Our May 28th meeting was an emergency. And so it wasn't, we have the recording, but we want to get the minutes out as soon as possible. So I was thinking for the May 28th minutes that we could just drop that last sentence about not knowing whether the normal rules apply, because they do.
That sounds appropriate.
Okay, and I got your typo, Al, thank you.
Yep.
Okay, so is everybody cool with the minutes of both these meetings, or are there emendations to suggest?
I
I'm
think
good.
they're good.
Okay, thank you.
Not on my end.
I will get those out to Grace right away. So, oh, too bad we don't have Arlene. I had forgotten. She told me that they were having this company, and that she might not even come. But annual town meeting is June 12th. And I believe she said that she would mark the ground with that pushy thing, if we want to do that. I promised Becky that next week we would put out a message explaining our recommendations about how it's going to be, but I'm not really clear at this point exactly what our recommendations are.
Well, it seems to me the question is, are our recommendations changing since the state and CDC recommendations have changed? Since we really discussed it.
Right. The state of emergency will still be in effect on June 12th. It expires on June 15th. So there's that. Supposedly the social distancing and masking guidelines are no longer, well, they're no longer enforceable. I don't know if you guys have noticed this, but kind of going out in the world, there's a lot of masking and social distancing going on. Right? People aren't quite ready to give up their masks. And I wonder if we should just recommend or encourage masking. What do you think?
Fine by me. I don't think there's anything to be lost in doing that.
Right.
We could acknowledge that in fact, despite the changes that are coming, that we still recommend masking and
Yeah.
Okay. Especially for the kind of the first big gathering out of the gate. And in that case, we would want to mark the ground because we can make the distancing part happen pretty much. By the way, the PTO is not going to have food and drink, but the library, the Friends of the Library are. So there's going to be that. And I believe we asked whoever was going to be doing the transaction to be masked.
Right.
And I guess also, both sides of the transaction. So we're going to need to make a plan to do the ground marking on Friday the 11th. But we can kind of do that unofficially. It's not something we have to do tonight because Arlene will do that, and she's not here. The other thing we need to do for annual town meeting is I have promised in the newsletter to have insect-borne disease materials for distribution. Because we pointed out at the planning meeting for this, we don't really have to avoid handing out pieces of paper at town meetings. So they're going to put out about 100 agendas, which are also available online, or going to be available online. And we can also put our stuff out. This is part of our agreement for the mosquito opt-out, which has been submitted. The application has been submitted. Full confession, I got it in late because I totally forgot about it and under the stress of all these other things. And Becky, God bless her soul, really helped me to get it in on Monday, which was a holiday. And so we got this snooty answer from them saying your application was late and we'll consider whether it's feasible to consider it. Well, you know what? It's no less feasible coming in on Memorial Day than it is coming in at the deadline, which was Friday night at midnight. So I think they're going to consider it. But who knows? Sorry, guys, I screwed up.
Totally excused.
Thank you. I feel about ready to throw myself off the roof.
I'm
But-
sure. Kat, when you say mosquito materials, you mean only about the mosquito district, or do you mean more generally, and we could contact UMass to get some materials? What was your thinking?
My thinking is basically everything.
Okay.
Not so much about the mosquito control district, but practical matters like how to avoid being bitten, how to reduce mosquito breeding habitat in your yard, that kind of thing. And the same with ticks. I want to put all the insect-borne diseases out there for people to have information about.
Okay, I think I have some previous contacts and information from attending those seminars. I can try and dig that out and contact them and see if I can get some free materials from them. Is that what you're thinking, Kat?
Yeah, and we have a bunch of stuff already, and we have some.
Oh, we do.
We have some little flyers, and we've got those cute little
Cards.
transparent cards with the
Yeah.
sizes on them. So
we
we
don't
can put
need
a
a whole
lot of
lot
stuff
more.
out. We don't need a whole lot more. Remember that thing that
Okay.
Andrew Lover did that had a map of a backyard with
Yeah.
we can put that out.
Okay.
That was good. And we've got a few things, but maybe you and I can work together to put together a
Yes.
package and
Yeah.
see what we need. We've
Yeah,
got
I'll help you.
10 days.
I know.
So there should be plenty of time to put things together and get them copied.
Yes, I'll help.
Thank you. And I think that's all we need to do.
And I can help Arlene with the lines on Friday before.
That'd be super.
I can probably help with that too.
Great. Okay. All right. As far as I know, we are going to have the little microphone covers. We don't have, last I knew, we didn't have them, but they had an order in. So presumably we'll want to go ahead with that.
Do we think we need to go to the extent of wiping everything down between use, or do we just make them available to folks and they?
I would think that just using the covers would be enough because, hand to hand and, hand surface transmission seems to be pretty much nil. But, they say if you're using the microphone properly, you're going to get lipstick on it. I mean, people are going to be really close to that one after another. So I think it seems reasonable to use those covers. Is there anything else about town meeting that we need to consider?
Just maybe talking about, I think this is our last meeting before town meeting. So what time should we be there? Last year, I think we were there early. So I don't.
Right. Yeah. Town meeting begins at 9, I think. I would think we'd need to be there by 8:30. We ought to be there by 8:30, but I don't think we need to be there earlier. It's not like we have any station to set up, right? Like last year we had the thing where Al and Arlene were up at the top of the hill and so on.
Right. So 8:30 for Board of Health members.
I think so.
And let's remind everybody, I think if we're going to wear our vests or hats, I think a lot of us have our vests now.
Yeah.
So just a reminder to everyone that you may have yours.
Right. Right. It'd be good if we would wear them.
I'm trying to get in on my. Sorry. I'm going to get off my phone.
And Catherine, do you think that Paul is okay with what he needs to say to folks, or do we need to? Because like last year, we sort of talked people through what they needed to do to stay distanced and protect themselves. I think it's fairly minimal, that.
Yeah, well, I'll kind of check in with Paul before the day comes, and just make sure that he understands what our recommendations are and are not. Right, so that we'll have the distancing, we'll be encouraging masks, we'll be requiring masks at the point of sale with the Friends of the Library, and I think that pretty much covers it, right?
What about while voting? Because that's indoors, right?
Right.
What do we do there? Can't remember.
Yeah, I don't know if we need to have a presence in there.
Yeah, but I mean, in terms of, did we determine that it was only unvaccinated persons should?
That's really a good question. Let's ask Grace what she thinks.
Okay.
Obviously, we are recommending masks for the whole thing. In Town Hall, they now have an elaborate ventilation system. Voting is fairly quick. A lot of people, as far as I know, are going to be voting earlier by mail, so it might not be really crucial. But we could. I'm not sure we have the authority at this point to require masks, but we could certainly strongly recommend them. Yeah, go ahead.
And perhaps have some to hand out if people want them. I think.
Yeah, they've got boxes and boxes of masks up there.
Mm-hmm.
But to your point, Catherine, everywhere I've been since the orders were lifted, people are largely wearing masks still.
Yeah.
I think people are taking it slowly.
Down at the Lever Co-op, they've got a sign on the door saying masks are required inside still. So, yeah, I think people want to wear their masks. It feels a little disgusting to expose people to your exhalations. I feel kind of anxious about it. Like, oh my God, I'm breathing on a person. Okay, well, I think we've got enough on that, and if there's more, we'll figure it out. Let's move on. On Montague Road, this is a new lot. It's new construction, so there's no variances. Charlie recommends it. The guys paid for it. Let's issue it, huh?
Yes.
All right. Now, 511 Pratt Corner Road. This is a mess. I don't know if you saw those emails on this. We have had a couple more emails on it. One was from Mark Stinson, from the circuit rider from DEP, who said, basically, we don't even have to do this. Charlie could have done it. He has the authority to declare it an emergency, but he bumped it to us. And we also got something from from somebody in Amherst. I don't know if it was the water department or who, but they said, basically what everybody's saying, let's just clean it up. Let's not stand on ceremony. Let's just do it. Yeah. So what I think that we should do is, I'll make a motion that we find this to be an imminent threat to the public health, and order them to clean it up within 10 days, to repair it within 10 days.
Second.
Everybody in favor?
Yeah,
Yes.
I think didn't Alan say that they plan to deal with it in the next 4 to 5 days?
I think the point with that 4 to 5 was it was going to take 4 to 5 days to do it.
Yes, that's what
And
I read.
it's not quite clear if Dennis is like ready to roll as the minute they get their authorization, or if it's going to take a few days. So I figured 10 days would give them a window in which to do it. And you know what, if it takes 11 or 12 days, we don't care. Just kind of get a little urgency there. Not that everybody isn't already feeling quite urgent about it.
Yeah.
Okay.
Yeah.
So I will issue an actual permit for us with a letter saying that it's an imminent threat and we want it repaired in 10 days.
Do we want to take a formal vote? I mean, there was a motion made and seconded, but.
Oh, that's a good point. Okay, I'm first in the alphabet, so I will vote in favor of this motion. Then we got what, Noreen
Yes.
and Garrett
Yes.
and Al?
Yes.
Okay. Thanks, Al. Okay, I'll do that. I'll do that tonight and get it to Tessa, who needs it in the morning, and there will be. And, oh my God, is that it? Is that everything? Because Mark already came in.
Do we have to talk about the issue that we have? Yeah.
Right. I don't know. I'm of two minds. On the one hand, Donna said we should respond and point out the factual inaccuracies and stuff, but it seems to me that we already did that once. And then he came up with a bunch of more stuff. And I mean, how long do we have to go through this? I had actually started doing that, and it was just kind of going down a rabbit hole. My feeling about it is that we've explained ourselves truthfully and completely, and possibly we could leave it at that. Now, there's 90 days for them to respond, so I think we might have a little time if we want to do something. Noreen, you are looking like you disagree.
No. I just wondered if it was. I didn't know what the time frame was. I think our time frame was 15 days last time, as I recall. We had a shorter time frame.
Yeah,
and I
was
just thinking. I thought Donna said if there's anything new or that substantive that we thought we should address. So, and I tried to go through that a little bit today. So, maybe we should all look through it again and see if there's anything, really important that we think that perhaps we didn't address in our first letter that should be addressed now.
Okay.
That's my only thought.
Does everybody have everything?
I don't have it in front of me, but I think I can find it.
I'll send it. I'll send it around again. Oh, by the way, I was looking for Donna on Friday.
Yes.
And she didn't answer my call, and she didn't show up for the meeting, and you didn't find her at the lake, although it turned out she was there, or she got there maybe after you looked. But she called me last night saying, "Oh my God, your message just popped up on my phone. It never got here until now." Wow. So I don't know what kind of phone service she has, but it obviously sucks. She was very apologetic.
Yeah.
And so I told her what happened, and she said, "Well, you did right, as long as everybody's been notified,
Well, it could be too. I had John Glory on the lookout, and then I came down to the Cape. So there could be a message on my machine that she arrived too. So I apologize.
Yeah, well, no problem. In any case, yeah, maybe we should look at it, but not tonight.
Yeah, I agree. Not tonight.
Frankly, I'm kind of fed up to the back teeth with this. We've spent an awful lot of time on it, and I'm so close to burn out. I can smell the smoke. I'm not sure, even if we are going to respond to it, I'm not sure that I'm going to be the one.
That you're going to be what? I'm sorry.
The
Kelly.
one who does it.
The one, yeah.
It might be that we just want to assemble some what did he call them, exhibits, the way he did, and just append them to the thing. I'm not sure.
Okay.
Or it might be Pardon?
Has anyone else looked at it closely enough to know if there are any outstanding things that we feel like we do need to address, as Donna suggested? Is there anything that's really, you know, an outlier that we feel like we just must address? I think is what we need to all look at.
Let me look at it for a second and
It's long.
tell
I
you
read
that.
it again today. It's long.
Yeah, it's very
Yeah.
long.
To be honest, when I read through it once, I didn't study it, and it was almost as if the points that we made were not acknowledged.
Well,
And
that's true. He persists in imagining that that we did
Star map.
things that we didn't do. Yeah, the whole map thing, which is trivial anyway, and I don't understand what harm he feels was done. And then this email that he quotes, I just don't know what's going on here.
Yeah.
I mean,
So
my
does
go
our
ahead.
original response also go to the Attorney General's office?
If we responded to this again, you mean?
No, the original response to the initial complaint.
Absolutely. We send it to Michael, but then we send the whole packet also to the Attorney General, and then we send the cover letter to Michael showing that we sent that. So they have what we wrote.
I mean, the only thing that stood out for me with this new one was maybe the need to clarify the Board of Health email and how that email is used.
Right.
But other than that, or to maybe make it a little bit clearer about all of the notification methods that are used for notification of public meetings, and you know, so there's no shortage of. This town does a really good job of having things in place to notify the public.
Right. Yeah, that would make sense, especially, and Donna mentioned that too, the business about the Board of Health email doesn't mean that the whole Board of Health got it. Now, there is one thing that looking through this that comes to my attention, and that is Exhibit 5, in which Michael asks Arlene and Becky for the data upon which BOH identified these two Shutesbury suspected hotspot areas, which of course we didn't. I have to say that when I looked at this was the first time I saw this message. I don't know if anybody else noticed that he had asked for specifically asked for information, but I didn't see it. I don't know if my email just collapsed it so that I didn't see it, or if I just went into such shock because the very next message after that is the one that started everything off in that thread. And so I never saw it. And of course, if I had seen it, I would have said, first, for future reference, public records requests are to be made to the town clerk. That's town policy. But in this case, don't bother, because we don't have any data. The data is the map. That's all we have.
Yep. I mean, DEP must have some historical information or some reason to know about that area and a dump in that area. But besides that, I mean, you and I were both surprised, Kat, when they told us about that.
Yeah.
Well, I don't think we should drop the ball. So I think Noreen's point is a good one, that we sort of read through it carefully and try to identify things that may need clarification.
Okay. Now, I believe that the Attorney General's office has 90 days, and they're probably going to use all of it, but we don't want to take a really long time. So I don't know if we want to squeeze in another quick meeting early next week to just work on that, or what? Any thoughts?
If we do have another meeting, I think it should be a meeting that just addresses this. So our full
Yeah.
attention goes to addressing this, and that we can do it rather. Hopefully we've all synthesized it and can do something pretty quickly.
Yeah. Okay.
Kat, when you resend the secondary complaint, will you also attach our response to the initial complaint so that they're together and we can look at them side by side?
Oh, that would be helpful.
Okay. Okay. Yeah, I'll send this and I'll send whatever we sent out. And I guess I'll send everything. His initial complaint, his second complaint, our response. And maybe the emails from Donna.
Okay. So do we want to meet next week to discuss this, to have and do we want to do it on a Wednesday night, since that's when we normally are available?
That works for me, I think.
Works for me as well.
Yeah, that would work for me. Sure, let's
Okay.
do it.
Let's do it.
Okay, I'm gonna put
Anybody
that in
have
the
that date?
minutes.
Anyone have that date in front of them?
9.
Thank you. 6/9/21 at 7.
Yeah.
Okay.
And is that a meeting that needs to be posted? And
Every meeting needs to be
all that.
posted.
Okay.
Yeah, even though we're not gonna, well, we hope not to do any business, but
And you have-
just that.
You have plenty of time to post that if you post it tomorrow or Friday, right, Kat?
Right, yeah, I could even
Yeah.
post it Monday.
Okay, great.
It's 48 hours, but I'll go ahead and post it
Might as well and have it
now
done.
or soon, yeah.
That way
Yeah.
we're not up against competing with other meetings and losing
Right.
it from the Zoom.
Oh, yeah, that's a good point. Let me check the meeting schedule.
Well, the
Where are we?
fallback can be that I host it, so.
Okay.
Yeah, but look what happened last time we tried that.
I just rode around the Quabbin. I'm not going to be doing long rides.
Oh, okay, yeah, right. If you're hosting a meeting, I insist that you just come home by 2:00 in the afternoon. Let's see, meetings, calendars. Okay, there are 2 meetings that night. The Council on Aging at 5:30 and Town Buildings Committee at 6. I'll ask Grace, or we could meet, on an earlier day, like Monday. Or I'll just ask Grace if there's a spot for us, and if not, we'll do it. We'll have Al do it.
That's
Any
fine.
thought-
Let's go with that, since Wednesday seems to work for everyone and we don't schedule other things on Wednesday for the most part.
Okay,
I agree.
all right. Let me get that on here. Okay, you guys,
Okay,
I think we might be done.
I
I'm
think
done.
so.
I
I know.
just have
Thanks
to say
again,
that
Pat.
I thought that the information and the presentations by DEP were really helpful.
Yes, totally.
Yeah, I did too, and I'm thinking that we ought to put something out with this information publicly, but I'm going to need some help with it. My notes are kind of all over the place, and our discussion was kind of all over the place.
I
So-
took some notes. I tried to take some notes, Kat, but I'm probably not the most knowledgeable person on this. I could try and help you as you put it together if you want. I do have notes. And I do.
I'll get started, and then I'll send it
Okay.
around to you guys, and you can add things or subtract things, and we can put together a good message. And I don't think we need to worry about violating an open meeting law for this. All we're trying to do is pass on what we learned.
And also, the one DEP representative was going to send an email to the Board of Health email with
Right.
additional references too.
With lots of
Right.
links.
Yeah,
Um,
yeah. So we should wait until Fred sends that.
The other thing I'm wondering now that we're talking about it is perhaps Kat, you and Al should be prepared to address some questions at town meeting, should they come up, on this topic?
Well, I'm not sure that they can.
Okay.
Because we have an agenda and they avoid having discussions on things that aren't on the agenda.
Okay, but doesn't the Board of Health usually have time to say something? Maybe not. I'm thinking they do, but I just
When
want to
we
be
have-
prepared. I just want to be
Yeah.
prepared in case something does come up, and it seems to me you and Al are the most knowledgeable, but I could be wrong. I'm just trying to think ahead.
I seem to be shedding knowledge at a rapid rate. When we have regular indoor town meeting, there's usually a town reports section. Last year, they didn't have it in the interest of making town meetings shorter. I don't know if they are not having it in this meeting too, because I haven't seen the agenda yet.
Okay.
But yeah, that's a good point. We should have a report. Well, I'll find out. And if they're going to have reports, then we'll put something together. And if they're not, let's not.
Yeah, I'm with you. I just remembered at one town meeting, I think we did have to say something. So that's the only reason I'm bringing it up. I'm happy to say nothing if we have to say.
Right. We've said enough, really.
Yes, we have.
Right. I mean, we've got that townwide announcement system, and I always tell people it's only a couple emails a week, and besides, they all come from me.
Right.
I'm practically the only one who uses it.
Okay, that's all.
Okay, let's call it a night. Thanks, you guys. That was great.
All right.
Thank you, Kat.
So we should move to. I would move to adjourn.
Oh, second, third, and fourth.
Yeah.
All in favor?
Yes.
Yes, please.
All right. I'm going to stop.
Okay.
And
Okay. Good night.
the cloud.
Good night.
Bye, guys.
Bye-bye.